give free healthcare,
Absolutely free.
absolutely free healthcare medication to underserved populations.
And what was the date
What?
of that?
Well, it's a nonprofit organization that been coming to Liberia since 2011. Our chairman, who is Joseph Akor, okay, he started the program, and this is my first time on this trip, and I'm sure Dr. Green is
Also my first time.
also a first time, and we hope it's first of many.
Can you give the historicity of this organization?
Well, I'm not too sure, so you will have to speak to Joseph Akor about that. I just gave you a little bit. They've been coming to Liberia since 2011, and it comes every 2 years. So the last year in 2018, we're here now in 2020, and hopefully, God will be back in 2022.
What are the services going to be provided on this trip?
So on this trip, we'll be doing general practitioner care. So any acute infectious diseases, chronic illnesses like diabetes, high blood pressure, arthritis. We can help with those things as well. So we have a separate eye care team that will be providing free cataract surgery and screening for patients at the JFK hospital. They only have to pay a $300 administrative fee, which goes to JFK. We don't receive any money. We're not charging for any of our services. That's just to cover some of the administrative costs.
How long are you going to be in Liberia?
So the mission will be in Liberia for 2 weeks through February 27th through March 15th. And so every day for the first week, we'll have teams split up going to different clinics around the communities, such as where we are here today, providing care to those residents in that area. And then our team will also be at JFK providing the cataract surgery and eye screenings, as well as we'll begin providing mental health services next week as well.
What are some of the areas you have visited surgery to? Surgery started at 8.
Well, we were on Duper Road yesterday. We visited that clinic. We were there for about 8 hours, and we saw about, roughly estimated, we saw about 150 patients. That's estimated. Okay. The day before that, where were we? Johnsonville Clinic. And we saw about 200 patients the first day that we came, because our team weren't split up, we're together. But yesterday was just Dr. Green and I, so it was a little bit, rough. So, but we saw as much as we could.
So how many patients are you guys planning to target? How many patients has been targeted?
As many as we can see until the light starts to go down.
So
What are the responses you're getting from the patients?
The patients are very, 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 very happy and excited that we're here. Because the patients that we're seeing, most of them haven't even been diagnosed with some of these illnesses that we're coming across. Like yesterday, I saw someone with blood pressure of 240 over 140. And I asked, have anybody ever told you that you have high blood pressure? I said, no. Okay, but you're walking around with blood pressure 240 over 140. And high blood pressure is a silent killer. You will have until you go to a doctor and they tell you, look, listen, you have high blood pressure. And that's where you start changing your lifestyle. Okay, I'm going to give you a little bit of history about high blood pressure. There's something called modifiable and non-modifiable risk factors. And we as blacks, African Americans, that's just one non-modifiable risk factor of high blood pressure. Okay, just from being black, the blood pressure will definitely be high. Okay. Another thing is hereditary. If it's in your DNA, if your mom, your pa, your sister, your brother, any of them were diagnosed with high blood pressure, chances are you will probably be diagnosed with high blood pressure as well. Okay, those are things that we can't change. You can't change your family history. You can't change being black, but there are things that you can't change that will help you be safe, okay? Like your diet. Okay, so I was telling them yesterday, some of the elderly people, I asked them, who prepare your meals, okay? I said, what do you put in your meals? Some people say, oh, we put Mekatic, we put Vita, like taking away those little things like sodium, high salt, not even the salt, like some of the seasoning is high in salt. So I'm not just going to tell people stop cooking salt, because then we'll put chicken soup in it, you know what I'm saying? And the chicken soup is high in sodium. So these are little education that people have not heard before. This is some of the things that we're bringing to the country.
So let's look at the Dupo Road clinic or the Johnsonville clinic. What were the most frequent sickness that you were able to identify?
High blood pressure. I had a young lady, 33 years old. That's the highest I've ever seen in a young woman like that. 33 years old. She could have a stroke like that anytime. And it will be more cost to the government to treat her with a stroke than if you start preventing it now. I know when I was small growing up, like there was a commercial that said prevention is better than cure. Okay, just by changing your lifestyle, start walking little by little every day. Change your diet, how you cook your food, right? Lose a little bit of weight. And you start telling your friends. And smoking, I see a lot of people here smoke cigarettes, all right? Smoking will progress the illness, okay? If you smoke, if you have hypertension, you have diabetes, it increases your risk of having a stroke, a heart attack, or even killing you.
Let's look at the sickness called diabetes.
Okay,
What are some of the causes or cure for diabetes?
okay, well, there's two types of diabetes. Type 1 diabetes, which we used to call in the States just, yeah, insulin dependent, and also it used to be like just kids were kind of like born with this
Juvenile onset.
juvenile onset
Juvenile
diabetes.
onset.
Yes, that's type 1 diabetes, and that you definitely need insulin. The one that it can give you, you inject it into your system every day, right? And then there's type 2 diabetes. Type 2 diabetes can be prevented, same way hypertension can be prevented, okay? All right, so that's a test that they test for in the States. I'm not sure if y'all have it here. I don't know, like, how you do things with the lab or whatever. But it's called hemoglobin A1C, right? It's a test that tests for diabetes, and they check it every 6 months. The numbers we like to see when I'm practicing, I like to see for like a young adult or somebody that's under 30, I want to see your A1C below 6. Right? When you start going over 6, you know, I will start educating you like, look, you're pre-diabetic, you have to be very careful. Start changing your diet, start dropping some weight, start exercising at least 30 minutes minimally a day, every day. If you smoke, stop smoking. Okay, but I've seen people with the A1C like 13, 14, which you will definitely need insulin. You're past just the oral pills. Okay, you will need insulin to bring your sugar down with the along with oral medication.
So, the kind of person coming to the clinic, adult and children, which one is more?
For diabetes,
No,
They're tenants.
I
You
mean,
receiving
like
more
young
adult than
mothers,
children?
young mothers are coming with their
children, the
children.
women, adult.
And even young people are coming also, because I guess, you know, healthcare is not readily available. So when they hear something is free, whether you're sick or not, you're gonna come. Even me, if I was living in the community and I know I'm not gonna see a doctor and I don't have money, I'm not sick, somebody say, oh, there's something free there, I will come there also to get something, right? That's just human nature. So everybody's coming, and we're open to everybody.
How many members of your crew are? How many members you have here?
How many
persons?
members?
How many persons on this trip?
That's a,
Providing the
we have a big crew. I don't have the exact number.
We're about 28, 20, 30, but we also have local volunteers. Like this is our young nurse from Liberia. She's an RN BSS. She's been volunteering with us, but she's very helpful. If you want to ask her any questions, you can do that.
So are all the 28 persons people here today?
No, we have 3 groups, right? We're here, the eye clinic, because we have doctors also that's doing cataract, which is the #1 reversible cause of blindness in your country. So cataract is easily cured. All right, so they're doing a lot of cataract. So, well, our plan is to do 150 to 200 cataract surgery, but we get into a lot of obstacles. But I think we're up and running now. We did one successful yesterday at JFK, and like she mentioned earlier, you only have to pay 300 Liberian dollars, and that is not coming to Liberian Medical Mission. We're not accepting no money. We're not collecting any money. We're doing everything totally free. But that $300 Liberian dollars is going to West JFK Medical Center.
I'm sure everything is not bread and butter. Are there challenges?
there's a lot of challenges, and like I said earlier, we're not going to go there. We're just going to talk about the healthcare. Okay?
Okay. In terms of cost and expenditure, what have you? What will you attach to this mission?
Well, like I'm not into like the politics of it or how.
That's not politics with me.
No. I mean, when I
the medication you're
when I
providing
say
now.
the politics of it, like that would be for our chairman
Yeah.
to answer
Chairman
those
Zachary.
questions. Okay? Me, I did a lot of fundraiser through my job, you know, and through my friends on Facebook. I created a GoFundMe page, and a lot of people donated to that GoFundMe page. A lot of people through my job, both jobs, were able to donate a lot. And I brought everything with me. Like these condoms that I brought, I'm going to be giving out to the young men and the young women. You know, I brought some naloxone kit, Narcan. What Narcan is, I see a lot of people here on drugs. I heard they're on opiates, right? Narcan is a drug that reverses opiate overdose. I'm not sure how the overdose population is looking like, but I plan on donating that medication to certain clinics that when they get those kind of cases, they can use it.
What do you specifically pick up on this trip? One day. What I mean? Yeah, you come in.
Okay, 1.9. 2.9. What we got in total that were donated, just donated. We don't get grants. People think like I heard Uncle Joe think people think that Liberia Medical Mission has a lot of money, that people give us money, give us grants. No, we beg for everything. Everything is given out of the goodwill of people's heart. So we came with $2.9 million worth of medical supply and medication.
What specific lessons did this team learn from this trip?
I learned that I need to be grateful for everything I have in the United States. That's the first thing I learned. I've learned that people that are here work so hard. I mean, it's different, okay? Healthcare wise, people that work in the health field, we have everything available to us. Like, I would take gloves from on the wall, they're falling down, won't even care to pick it up. But I see nurses here struggling for gloves. They don't even have gloves to put on to take care of patients. Okay, and that's why so many people, healthcare providers, healthcare workers died during the Ebola time because they didn't have the necessary equipment to protect themselves.
So what message will you be sending out to those who are not in the know of your being here now? Those patients are supposed to be benefiting from this gesture. What message can you use to the medium to get a traffic?
Okay, what message I could give that people that's not going to be able to come? What I tell you to do is prevent yourself. Prevention, like I said earlier, is better than cure. Okay? Just by losing weight, by walking, by exercising, okay? By changing your diet. Some of these illnesses, although some of them, once you have it, you can't really cure it, but you can slow down the progression of the disease just by changing your lifestyle.
So what is
And
your,
that's the main point I want to focus on.
what is the schedule tomorrow? What SE will you go with?
Tomorrow, I don't know. Honestly, I don't know what my schedule is because we get the schedule the night before.
Yeah. So there are a lot of logistic issues and things that we're coming into. So unfortunately, we don't always know until the day before. But anybody can always go to the Liberian Medical Mission and social media, Facebook, and we'll keep that information updated and just listen out to the local radio stations, and we'll put out that announcement the day before as well.
So tomorrow is Friday, right? Or is this Friday? Tomorrow is Friday. From what I'm saying, we're going to be Bentonville Health Center in Monserrate County. All right, Group of 77 Disability Center, Monrovia. I don't even know where that is. And the ophthalmology people, the eye people, they're going to be at JFK. That didn't change. All right, and we do have a mental health team, okay, which is run by Dr. Wilhelmina Siemens. She's going to be at Gender Ministry and Sister Circle Adult Literacy Project event tomorrow.
Any other thing that will interest you?
Y'all were really good. You know,
I
was,
love it.
I wasn't nervous at all. I thought I would have been nervous.
Oh, you weren't nervous?
No, I wasn't that comfortable. I got a little
Let's get
comfortable.
off the word.
Y'all professional.
So what's your name?
Elizabeth Pusa, graduate from
Oh my
UN
God.
Winnipeg High College of Health Sciences. I'm not working currently.
They are.
So you're a volunteer with the group.
Yes, it's my first time volunteering with the group, and I really appreciate their presence here because they are actually working a lot, and they really make patients feel comfortable. They are not proud people.
What are some of the things you're learning?
Well,
Extremely large and grateful.
there's nothing strange. We are actually doing the same medical practices. So we are just helping the people from America out to interpret our people to them because they don't really understand all of them. Even though they try to understand some of them, and basically that's what we are doing. But it's the doctors that are seeing the patient because you know for us here at some clinics, nurses that will be doing the screening and seeing the patients. For now, the nurses on board are doing vitals, like they're taking the blood pressure, the temperature, the heart rate, and then taking them to the physicians.
Okay. And then also one question. What would you want to tell other medical practitioners in your case? What message do you want to give to those who are volunteering, secretary?
Yeah, it's actually good to give up your services, and I want the public and my fellow health workers to know that this field is a humanitarian field. They shouldn't put forth money. It's not all about money, but it's about gaining new experience and saving lives. Yeah. Thanks.
We can take some of the picture. Yeah, wait. Now that's the picture. Can you just take the two? Can you just take the two?
That was one of the picture.
Group picture?
Just take the two and just tell me that what you guys working.
Okay, yeah.
What you working? Okay. Yeah, then you just be explaining some of the things that you guys are working for. That'd be good. Yeah. That'd be good. Okay. Yes.
So these are some of the patients that we're going to be seeing. Agnes, I'm sorry, this is one of our volunteer nurses. She's from the state. Just where you're from, what hospital you're affiliated with.
Your name, ma'am?
My name is Agnes Barrow. I'm a nurse. I'm from Kansas City, Missouri. I don't know why that's
And how does it feel being in Liberia?
Oh, it feels so good, but the heat won't kill me.
And this is one of our nurses.
My name is Marcel Cisco from Philadelphia, the city of love.
The city of brotherly love.
Okay.
I'm just here to help our people.
Right. These are all the patients that are waiting. You know, hopefully we could bridge the gap. That's our goal. That's pretty much it. We have our pharmacy team. Yeah, I know how I can take you guys there.
Yeah. We are walking through the hospital here in District 15, Maserati County.
This is one of our logistics team member. His name is Peter.
Okay. Good afternoon, sir.
Let them know what state you're from. What state you're from?
I'm Pete Flora from Texas in the United States.
From the United States. How do you feel being in Liberia?
Well, we feel very welcome. It's been a really good experience. The people have been very kind and generous. So
How's the heat? How's the heat?
I like it.
What are some of your experiences? Your experiences?
Well, we've had a lot of very good experiences. A gentleman fixed our bus and didn't want to take any money for it. And just a lot of generous, kind people that have been very nice to meet. Thank you.
Thank you.
All right. They're very busy. Okay, so we'll leave them alone because they're very busy, as you can see. All these medication here is totally free. Everything we're going to prescribe in terms of diabetic medication, hypertension medication, we're going to be giving out 6 months supply. If we don't have more than that, we'll refer them to local doctors to continue refilling the medication.
Okay. Thank you.
Welcome. Okay, we're going to start now.
Okay.
Okay. All right. I mean, everybody kind of busy.